So one other common ailment that so many people have, men and women, is incontinence or bladder issues or leakage. I tell all of my male clients, if you imagine 20 years old, you're going to the bathroom, there's a steady stream, you're just like this racehorse that's just a steady, steady stream. And then you get to be about 30, 40 years old and it's like, it's not so steady anymore or strong. And it's like, wow, it's kind of weak. And it's like kind of dribble afterwards. And you know, women have some of these symptoms as well, but it's very common in men, and men don't talk about that. So when there's dribbling afterwards or leakage, jumping on a trampoline, my gosh, or running, and women are regularly wearing mini pads to catch these leaks because they start leaking at a pretty early age, especially after childbirth. That can really mess up the bladder. Abdominal surgeries, hysterectomies, you know, all of those kinds of things that affect the bladder can have a huge impact on our bladder health as well, which also is in the pelvic bowl. So the bladder dysfunction, maybe you've never had a surgery, maybe you're a guy and you've never had a baby, right? And it's like, why do I have this thing? How does this happen? So let me give you a few scenarios of possibilities. Say you twist your ankle, and that twisted ankle is injured. Your brain sends a signal all the way down to the foot and says, hey, you muscles pull this way, you muscles pull that way, and let's protect that ankle. Well, those muscles are also part of the function of the ankle. Pretty soon you lose dorsiflexion, which is the ability to lift your toes, and then it all of a sudden starts affecting your quadricep on that side. And it's like, wow, that's really pulling down. And because we're fascially connected head to toe, because every cell in our body is fascia, all of a sudden it's pulling these quadricep muscles that attach up on the pelvic bowl, they're pulling down, and now the pelvis is out of balance. Well, and then the bladder gets pulled out of balance because it's fascially connected to everything, right? So now it's pulling the bladder out. Well, okay, so if you're a guy and you got your prostate back there as well, and that has very intimate connection with the urethra and where the urine has to go through, then all of a sudden things are pulling fascially and you're like, how did this happen? Well, it didn't happen overnight. It's been happening for a long, long time. If you have gone through a period of dehydration, everything sticks together. All these cells that are supposed to be separate, they're all of a sudden sticking together, and then things start pulling on each other. And the brain's like, oh, you're getting pulled over here. Okay, you over here, pull it back over here. And we're trying to maintain homeostasis constantly. Our body's constantly attempting that. So we twist that ankle, and all of a sudden, 10 years later, the fascia is pulling all the way down the leg and pulling everything out of place. That can cause the whole urethra to be pulled fascially over. In my early practice, I quit this pretty early, I'll ask a guy, have you ever been hit in the groin? Well, who hasn't? It's external genitalia. How can you not get that hit, right? That hit to the genitalia puts it into a contraction, and when we're young, our body can compensate for it. But over time, it doesn't compensate so well, and our body runs out of compensation room, usually about 30, 40 years old, depending on your level of activity. And when that happens, all of a sudden you're like, dang, I kind of stumbled off the curb and I can't quite recover like I used to. So that's where you go to a body worker that works with fascia, and then we can undo all of that damage and protective mechanism that's been happening for so long. When I'm working with the bladder, let's say the bladder is stuck to this bone because of inactivity or dehydration, long periods of dehydration, things just stick to each other. If I'm going to release that bladder from the bone, I'm going to bring my hands in here, hold the pubic bone, and then grab the bladder here and do my technique, and it just gently allows that bladder to lift off of there. Just with that technique, a lot of people experience a lot of relief. This is done with clothes on. I prefer people wear spandex or sweatpants or athletic shorts or something so that I can find these bony landmarks and get down to the pubic bone without buttons and buckles and zippers and all that stuff. And so I can work with the bladder there. I can come up to the kidney that has the ureter coming down through here and then to the front where it dumps into the bladder. And I can work with all of that soft tissue that's pulling on the bladder possibly. Our intestines and reproductive organs all sit in this pelvic bowl. And when we have anything in this bowl that's in dysfunction, it sits right here on the sacrum bone. So many people, the sacrum bone cannot move, or it's hard and it's rigid. Maybe they've fallen on the ice or the steps and it's rigid in here. That could be it, but what about the possibility, and they have low back pain. You got pain back here, but what's on the front, right? So all of these organs that are in this bowl, if they're in dysfunction, you have leaky gut, you have bladder dysfunction, uterine dysfunction. If you have dysfunction here, it's gonna stick to the front of the sacrum, and then the brain goes, hey, we've got dysfunction down here. You muscles, you back muscles, you pull tight here, you pull tight here, you pull tight here, and we're gonna protect that back from being pulled forward. Okay, so now you've got tension on both sides. So some people with low back pain, simple fix, go in here and check the organs and see what's going on with the organs. So that back pain could be a pelvic health issue.